Are PTs and OTs really using AI now? And more importantly, should you? If you've ever thought AI sounds cool, but how the heck would it actually help with treatment planning or documentation? You're not alone. Today we're breaking down how AI can support physical therapists, occupational therapists, and assistants without turning your notes into cookie cutter nonsense. We'll cover the pros, the cons, and what to look for in an AI tool so it actually saves you time instead of creating more work. So hey there, I'm Stephanie the PT, and together with Nicole the OT, we are the founders of the Note Ninjas and the creators of the Note Ninjas membership and pediatric series. We help PTs, OTs, SLPs, and assistants streamline documentation and make treatment planning faster, easier, and more defensible across any setting. And yes, we've built an AI clinical assistant into our membership. So today, we want to show you what's actually working, what isn't, and how you can use AI the right way in your practice. Let's get into it. AI is everywhere right now, but can it actually help PTs and OTs, or is it just another tech trend that creates more work than it saves? If you're a therapist, you're already juggling evaluations, progress notes, productivity, documentation, and everything in between. So when you hear people say, just use AI, it'll save you time, you might be thinking, yeah, right. Because let's be honest, is it accurate? Will it save you time or just give you more to clean up? And how much do you have to train it before it's actually helpful? So let's break it down. The good, the bad, and what we've done to make it actually work for therapists. So first, let's talk benefits. AI can save you hours every single week. Whether you're stuck on how to phrase a defensible goal, looking for documentation examples, or brainstorming treatment ideas for a complex patient, you don't have to start from scratch. Next, it's available 24/7. Even after a nonstop day of patients when your brain feels like mush, it's there to guide your thinking and give you a jump start without overthinking or second guessing. And it reduces the cognitive overload because let's be honest, whether you've been practicing for 2 years or 20, this job demands constant problem solving. An AI clinical assistant takes some of that load off your plate so you can focus on what actually matters, providing great care. If you've tried using ChatGPT or a basic AI tool for documentation or treatment planning, you've probably run into the same issues we did. You get genetic answers. It suggests unskilled treatments. It gives cookie cutter phrases that don't sound like you at all. And worst of all, you spend more time trying to explain what you need than if you just done it yourself. And that's because AI is only as good as what it's trained on. You can't expect it to magically know what's medically necessary, or how to write defensible documentation, or how to generate treatment ideas that match your setting and your patient, unless you teach it, line by line, over and over. And who has time for that? That's why we did it for you. Inside our Note Ninjas membership and pediatric series, we have an AI clinical assistant, and we trained it using all of our own resources, which means you don't have to explain what CPT code to use. You don't have to tell it what's skilled and what's not. You don't have to dig into old notes for examples. It already knows how you work because it's built by therapists for therapists. You can ask it questions like, what are 3 treatment ideas and documentation examples for standing balance after a stroke? And it gives you clinically sound, defensible ideas in seconds. You don't have to waste time rephrasing things because it's already trained with our templates, treatment banks, and strategies for adults and pediatrics. Whether you need acute care, outpatient, home health, SNFs, school, it gives you answers that actually match your patients. AI is not a replacement for your clinical reasoning. It's not a shortcut for poor care, and it's definitely not a substitute for experience. But when it's built right, it becomes your assistant, helping you save time, reduce burnout, and feel more confident in your work. And that's exactly why we built it into the Note Ninjas membership. So if you're curious to try it and see how it can support you in your setting, head to the link below. You'll get full access to the AI clinical assistant already trained to work like a skilled therapist. Thanks for watching, and make sure to follow us at the Note Ninjas for more treatment ideas, documentation strategies, and time-saving tools that make your treatment sessions smoother and your notes stronger.